Hello, everyone. So, if you're watching this, there's a good chance that you care about your heart health, or maybe you're worried because someone in the family has had a heart attack or stroke, or maybe you've noticed symptoms and you're wondering if it could be heart related. And so you may be thinking, do I need a pill? Is this number bad? Maybe you just got test results. Should I be worried? But when it comes to protecting the heart long term, the biggest shift happens when you can answer specific questions, ones that can guide prevention. And so I know some people, you get your lab work, you have your physical, and you may still not be sure where you stand. So I want to walk you through 5 heart health questions that can be really helpful because answering them helps you focus on what is proven, what is actionable, and what actually lowers your risk over time. So I'm Dr. Lola Ashaye. I'm a board-certified family and lifestyle medicine physician and owner of InTouch Primary Care in Sugar Land, Texas. And here at InTouch, what we do is we help you more easily become and remain healthy so that you can live fully and enjoy doing what you love. So I've been practicing medicine for almost 20 years now, and over that time, I've noticed something important. Heart disease is the number one cause of death worldwide. It actually causes more deaths than cancer and many other conditions combined. And so, because of that, it's a huge part of preventative medicine, trying to prevent heart conditions. And many people are genuinely trying to live longer. They want to live healthy while they're living longer. And what I find is a lot of times the approach is fragmented. So somebody will hear about a new supplement. They may take it for a few months and then stop because they're not sure if it's working or not. Others might cut out some stuff from their diet, maybe decide to go vegetarian for even a few years and then stop. Some become very focused on a lab number like their cholesterol, and then they ignore, blood pressure and all the other important things like blood sugar. But the thing about it is, heart health doesn't work that way. It's a comprehensive approach that works the best. And today I want to share questions that can help you build a strategic, systemic plan so that you're not guessing and you're not reacting, but you're making informed decisions. So when you step back, you can ask these 5 questions to give you a clear framework. So if you want, to share this with someone now, go ahead and share, go ahead and subscribe and like as we get into the questions. If you can think about somebody that could truly benefit from this, please share this with them. Okay. All right. So number one question to ask, what is my real cardiovascular risk? So this is really important to understand because there isn't a single test or number that tells you the whole story. Your real cardiovascular risk is determined by several factors: your age, your blood pressure, your cholesterol, whether or not you have diabetes, whether or not you smoke, your family history. And we can actually calculate a 10-year or even a 30-year ASCVD risk. And that number is going to change over time because your age changes, your blood pressure changes, your cholesterol levels could change. And it matters because two people with the same cholesterol levels can need very, very different approach to their heart health based on all the other factors. So if you don't know your overall cardiovascular risk score, you're making a lot of decisions in the dark. And this often explains why some people might need a medication and others don't. So it's important to ask, what is my overall cardiovascular risk? And your doctor should be able to help you calculate that. Okay. Number two questions, what numbers matter the most? So when it comes to heart health, there are certain things that matter. There are metrics that form the foundation of your risk assessment. And these metrics include your blood pressure, your cholesterol, which will include your total cholesterol, your LDL, which is your bad cholesterol, your HDL, which is your good cholesterol, and a fat called triglycerides. It's also going to include your blood sugar or A1C, and there are many other types of tests around insulin resistance that can be done to properly assess this. It's also going to include your weight and your waist circumference. So it's important to understand this is an overview of certain things that are basic and foundational. However, there are more detailed testing that might be required depending on the person. So, for example, I get some people that get really excited because they have been told that their good cholesterol is high and they just, focus on that one number. Well, that one value doesn't replace the full risk assessment. It adds context, but it doesn't replace a complete assessment. So one test does not tell the whole story, and that's important to note as well. Okay, so question three. What actually lowers heart disease risk? Like, what is proven to lower disease risk? And this is where things sometimes get confusing, especially when people are getting non-medical advice, so online advice. And the problem is there are some things that change numbers. So your numbers can look good, but some things actually change outcomes. And that's what we need to focus on, the things that change outcomes. And that's where evidence-based research comes in. So, in terms of what changes outcomes, the most effective proven strategies for lowering heart disease risk are actually things that we're all very familiar with and have been very consistent across decades of research. So, over and over again, the strongest evidence points to the same foundational things: blood pressure control, cholesterol management, movement, nutrition, weight, sleep, and avoiding harmful substances like alcohol and especially tobacco smoke. So these don't sound very exciting, but they're very consistently the most powerful tools that we have for preventing heart disease before it starts. So, for example, lowering blood pressure reduces heart disease risk even more, about 20 to 25% for each 10-point drop in your systolic blood pressure. So it reduces your heart disease risk if you're able to lower your blood pressure by 10 points, by 20 to 25%. If you're able to lower your LDL cholesterol, you can reduce major heart events by 20 to 25% for every meaningful drop in your cholesterol. So, also, quitting smoking lowers heart-related death risk more than most medications. So, for people that smoke and are on medications, it's like, do the best thing you can do is actually to find ways, get help. If you need to use medications to quit smoking, that's actually a better strategy than taking medications and smoking. Okay. So all these require healthy lifestyle habits because health habits lower overall cardiovascular risk, not just one condition. And it does it with multiple pathways. So healthy habits will result in lower blood pressure, lower healthier weight, lower inflammation, lower insulin resistance, and just overall metabolic health. So this is why, regardless of what you're doing, having a foundation of healthy lifestyle habits is required. Medications obviously can help too, especially when the risk is high enough, but they still don't replace the healthy habits because medications tend to target one or two conditions, right? So you can take medication for high blood pressure, lower your blood pressure, but unaddressed high cholesterol will still put you at high risk for heart disease. So even when you're taking medications, it's important to do the lifestyle habits because they're still necessary to give the best outcome. Okay, so number four question, what about supplements? Do they actually help and when? And this is a very common question, right? So for primary prevention, meaning that before someone has had a heart attack or stroke or any kind of heart disease, the evidence for supplements is actually quite limited. There are only a few that show promise, and that's in specific situations. So, for instance, folic acid is particularly in populations without food fortification can lower the risk of strokes, right? So that's if people are deficient in folic acid and they take it, or they have conditions that make them deficient in folic acid. So that can be helpful. Prescription EPA for people that have high triglycerides and are already taking cholesterol can be helpful for them to take prescription EPA. Magnesium for people with certain risk factors can be helpful. CoQ10 for people with heart failure or statin-related muscle symptoms can be helpful. So, in terms of evidence-based, in terms of research, it's important to know there are many popular supplements, but many have not been shown to reduce outcomes, which is heart disease and strokes. They may help in improving numbers, but in the general population, the research is kind of limited. It's not all there to prove that they actually make a difference. That doesn't mean that they're not helpful for other things or that they are not helpful, and we will find out eventually. But it's just important to know that we can't rely on them as the primary way of lowering heart disease risk. Supplements can be helpful in addition in selected people, but they don't replace the fundamentals. So that would not, supplementing is not the, should not be the main strategy, in other words, if you're trying to lower your heart risk. Okay. So, number 5, what habits actually lower risk long term? So, I'd mentioned that lifestyle habits are important. So, what lifestyle habits? We come back to the good old nutrition. Nutrition matters, the Mediterranean style diets, which emphasize vegetables, fruits, whole grains, legumes, nuts, fish, healthy fats, while minimizing processed foods, saturated fats, added sugar, show the strongest evidence among dietary patterns. It reduces mortality from all cause. It reduces heart mortality. It reduces strokes. It reduces heart attacks. So doing a diet, adopting a diet that emphasizes the things I mentioned is really powerful. Regular movement matters too. So trying to aim for 150 minutes of moderate activity per week with strength training 2 times a week can be really helpful. Weight management, sleep, stress management, and avoiding smoking and other harmful substances also can be helpful. So these don't work overnight, but they're foundational for real prevention. And yes, if you're aggressive with lifestyle early, a lot of people can delay or reduce or even avoid medications down the line. So, if you are interested in lowering your heart health, these are the questions you should ask. What is my real cardiovascular risk? And like I said, this can be calculated with the help of your doctor after there's understanding of your risk factors. Remember, it's not one number that helps you decide this, it's multiple factors. And at InTouch Primary Care, we proactively assess this for our patients. Number 2, what numbers matter for me? So key metrics like your blood pressure, cholesterol, your blood sugar, your weight are foundational. And these are part of your vital signs usually included in your annual labs, which is why your yearly physical matters because this is our opportunity to get these numbers. Number 3, what actually works consistently? So keeping your blood pressure and cholesterol in healthy ranges with or without medication, avoiding harmful substances like cigarette smoke has a much bigger impact on heart health than most people realize. Number 4, what role do supplements play? Well, for primary prevention, evidence is quite limited. Supplements may help in specific cases or for other goals, but it's important to be clear about why you're taking them and also understand that they cannot be the main strategy. And then number 5, what habits matter most? Well, daily habits matter more than almost anything else. Mediterranean style eating, regular movement, strength training, good sleep, stress management have the strongest evidence for long-term heart protection. And I'm going to be going deeper into the nutrition piece in upcoming videos. So subscribe and stay connected to learn more. So if you are watching this, it's because you care about preventing heart disease. And one question that often comes up alongside this is aspirin. So I recommend watching my video, Shall I Take a Daily Aspirin? Because for many people, that answer isn't what they expect. real prevention isn't a 1 minute conversation or a rush decision. It usually takes time, it takes context, it takes reassessment. So if you're in Texas and you want help understanding your personal cardiovascular risk and what actually makes sense for you, here at InTouch, we offer unrushed proactive care. So if you're deciding whether or not to take a pill, what kind of lifestyle changes you want to do, what works for you personally, what kind of testing, and you need guidance, we're happy to help you along. So you can schedule a free 15-minute consult to learn more about our services. At the end of the day, remember the goal isn't just doing everything. It's really about doing the critical things in at the right time so you get the desired outcome. So I hope that helps.